researchers around the world are trying to develop medicines that stop the progress of Alzheimer's disease. One drawing particular attention is a drug developed by the University of Aberdeen. That medicine is called Rember. Professor Claude Wischik is the developer of this new treatment. He's been studying Alzheimer's for many years, focusing on hallmark changes in nerve cells. Brain nerve cells go through various changes before the patient develops symptoms of the disease. First, a protein called amyloid beta, indicated in yellow, accumulates between nerve cells. Then, another protein called tau, shown in green, congregates inside the cells. Once exposed to these changes, the nerve cells die. Professor Wischik theorized a substance breaking down the tangled tau could prevent the cell death. Once he discovered such a compound, he immediately started to develop a medicine from it.
Well, I was excited by it, but the first discovery was something that seemed very promising at the time. And I thought already then, and this was back in the 80s, that ultimately this would be a treatment.
Professor Wischik's brainchild, Rember, is now being tested in a human clinical trial in the UK. James Hardy is among the patients participating in the trial. At a glance, he seems to be a healthy man without any problems. In fact, he was diagnosed with Alzheimer's in 2005 and has had to endure hard times. At that time, James had severe memory loss. He also had trouble carrying on conversations. James's wife, Dorothy, was deeply alarmed by his ever-worsening symptoms.
He would sit around the house most of the day. Difficult to communicate with him. He was in a state of panic in a sense because he didn't know how quickly the illness was going to progress.
The following year, his doctor suggested he enroll in a clinical trial of Rember. Desperate for any chance to arrest his disease, James decided to sign up. He has been on the medication ever since. James was among the 321 subjects taking part in the clinical trial. Here are the study results. For patients taking Rember, the deterioration of cognitive functions is lower than those who were not on the drug. Once he started using Rember, James's memory lapses improved. He now has no trouble talking to people.
You didn't expect this, did you? Is there any movement?
I Paul got one after about 10 minutes.
Aye,
and then we've got two little tiny perch since then. Okay.
James is grateful for having been able to join the trial.
It definitely changed my life. I mean, I feel a lot better, and I think I'm doing things now that I wouldn't have been able to do then, like it.
Encouraged by the results so far, the Rember development team is planning to start a final stage clinical trial in 2011, aiming to get government approval for marketing the new treatment.
Almost at the end, there's just one more clinical trial to do, and then that's it, and the drug can be given to people.